CMH, and Watson Motors.
102.7 WMOM 746 now, 14 before the top of the hour. Let's bring in our sister station and chat with this gentleman here in the studio. Hot Country Hits 99.9, home of your new country and your all-time favorites. In the studio with us, Dr. Weston Squires. Is it with an S or not? Because sometimes I add an S and sometimes I don't. But what do you got? S or no?
For Squires?
Yeah. Well, you are Squires. Okay.
Squires,
yeah, there you go. Hey, and we appreciate you coming in because we want to chat about some awards that you just received. By the way, congratulations on that.
Thank you.
And located in Scottville, right off of US 10. And over the next few minutes, I'm gonna pick your brain a little bit. Is that fair? You ready for that?
Pick away.
Okay, sounds good. First of all, you just were awarded the best chiropractor in the area. There's a lot of chiropractors here in the area.
There's quite a few. Yeah.
How do you feel about that?
It's a humbling experience to get voted number one. It's awesome.
Absolutely.
Yeah.
Why, if you had to take a piece of paper and write that down and be like, okay, these are the reasons why this is an opportunity for you to have a little bit of pride here in yourself and your team. Why do you think that people gravitate towards your practice and feel like, hey, we were voted number one for this reason or that reason?
I would say the experience.
Okay.
From the time you walk in, the staff is treating you like family, and we try to find all avenues of getting rid of your pain and discomforts.
Yeah.
So, it's one of those things, if people come in pain, you want to help them as much as you can, and if you can do that, which luckily we're pretty successful at, I would say that's probably why we got voted.
And people, we talk about pain as an example, and we have people that honk us and go by, so bear with us. Yeah, absolutely. When we talk about pain, we're not just talking about like back pain and other pain. People experience a ton of issues out there that, from a chiropractor standpoint, you're not just focusing on the spine and such, right?
Our spine is our main target for sure, right? Because it kind of houses all the nerves that go to the whole body. But we treat pain from the top to the bottom. Okay. It's not just back pain. It's migraines, shoulder pain, knee pain, foot and ankle pain, you name it. So, absolutely.
How many people, if you had to just throw a number out there that are walking around with an adjustment, with going to see somebody like you or your team there, would lead a better life by just going through that? And I say that in all seriousness because you get adjusted and it's like, wow, I had no idea I was dealing with all of that. What do you think? Do you think there's a ton of people out there like that?
There's a lot of people in pain and don't even know it, or they're not living their best life because they've got subluxations, their spine isn't working right, their body's just not functioning right. So my general rule is if you have a spine, you should probably see a guy like me or a female chiropractor, whatever. Get assessed, get checked, make sure everything's okay.
Do you think a lot of people cover it with medication and stuff like that? Is that what we're dealing with?
That's a big problem today. Yeah. People turn to the bottle versus other natural methods.
Absolutely. If you're just joining us, Dr. Weston Squires in the studio with us this morning. A year after you took over the practice from your dad, just about a year ago, over a year ago now, and he was practicing for nearly 45 years, is that right?
44 to 45 years, yep.
Okay.
Right there.
As a kid growing up, what was that like? Were you, I envision you kind of running around his office and so on and so forth.
Yeah, I was there quite a bit. The biggest thing that I noticed looking back as being like a son of a chiropractor is I was rarely sick.
Okay.
Rarely sick. Yeah. So that's something that just kind of contributes to the benefits of keeping your nervous system running well, keeping your spine in operation. And I also did pretty good in sports as well. So lower injury rates, stuff like that looking back. So I definitely think it's beneficial as a kid growing up to have adjustments as well.
And you seem like you have actually better posture than obviously when you walked in, I'm like, man, I've got to straighten up. But posture is important in so many ways.
It's huge
from a success standpoint, right? And from a health standpoint. Break that down for us for a moment, if you don't.
If you just look at people that work at a desk all day, or if you stand all day, you're naturally going to start slouching.
Yeah.
our spine isn't really designed to be in those positions. It just, the muscles get tight and then it starts to favor the tight muscles, and then we end up having early onset arthritis, pinched nerves, other disorders, things like that come in sooner versus later in life. So I think posture is huge. There are some small tips that you can do both in a sitting position and a standing position. I have a kind of a fun one that I treat, or I tell patients about that I treat with. It's chin up, chest up, squeeze the pickle. And everyone says, what's the pickle? It's in between your shoulder blades. So we're squeezing the pickle. Yeah. People remember it because it's kind of goofy.
Absolutely.
So, yeah.
That's pretty, and it works.
It works great.
Is it something, I know I don't want to give everything away this morning because we want people to come see you, obviously.
Hey.
But sure. If you had to say to somebody, you should do that movement, how many times, how frequently, how many days, what is that breakdown like?
If they were to do the chin up, chest up, squeeze the pickle a couple times an hour while they're at their desk for 15 to 20 seconds, that really helps kind of activate those back muscles to start working again. So,
there you go. That's cool. Yeah. Did you learn that from your dad, or is that yours?
That's mine. That one's mine. The squeeze the pickle is mine.
That's cool. Yeah. That's awesome. What was some things that you learned from your dad over the years? What stood out for you?
I guess the biggest thing is when I came out of chiropractic school, I got experience very fast because he had a pretty high-paced clinic. So we went right in, adjusting a lot of people a day. He was more old school, so I got to learn all of the old school kind of stuff, but I learned all the new school stuff. So I've kind of become a little bit of a hybrid, old school, new school, which is nice to have because we still have a lot of patients that used to see him quite frequently that I can still treat and service just fine with the old school maneuvers.
Absolutely. So, and some people don't like, there's a lot of new technology out there. And,
a ton.
Yeah. And sometimes it's like, no, I just want this done. And you probably have that conversation from time to time with your patients.
Yeah, we have a lot of different ways that we can adjust someone. So our thing is to tailor to the patient. So there's no cookie cutter approach in the office. I don't adjust patient 1 and patient 10 exactly the same. Each patient in between is different. We do really light techniques all the way up to a little bit more aggressive manual techniques for some individuals.
Let me take the devil's advocate just for a moment. Is there people out there, and I haven't met them, so maybe there isn't really, that are against chiropractic services and getting adjusted and such? Sure. For instance, when I was growing up, we always hear, don't crack your knuckles, right? Because you're going to get arthritis.
Sure.
By the way, is that true?
Not necessarily. I guess it depends on how you do it. You'd be more apt to having like ligament or tendon damage from overcracking than the actual joint.
So when it comes to people, is there people out there that are like, no, you shouldn't get adjusted. That's going to harm you more than help you. Sure. Does that happen?
No.
Okay.
No, not really. There's certain kind of protocols that we learn in school about time, frequency, period of treatment. So, obviously, if you overdo anything, you can have repercussions and things like that where you have injuries. You overdo a sport, you can have injuries. You get over adjusted every single day forever. Obviously, it's too much, right? Yeah. So, as long as you're doing the right frequencies and the right protocols for your conditions, it is a huge benefit.
You got 4 staff members there in Scottville. Not only by the Reader's Choice did you become just recently, like this week, the best chiropractor in the area, but also you can add Best Business in Scottville.
Yeah.
That's huge.
That's cool. Yeah, we got 2 awards this year.
How do you feel about that?
That's great. And I think a lot of that goes back to the staff being awesome. Okay. So, we've got Tina, Kaylee, Christine, and Spencer at my office, and they're all rock stars. They work together pretty good. Patients definitely respond well with having a good atmosphere in there as well. So
it's very cool.
Yeah.
If you're just joining us, Dr. Weston Squires here in the studio with us. And let's see, we talked a little bit about health, obviously your achievements, but you had a chance to grow up in this industry, in this particular category, health. Yeah. What do you think from the internal side of things, from the medical standpoint, that things have changed? We talked a little bit about technology, and I want to talk about some of the services as well that you offer. But what do you think? Has the patient changed too over that time period? Do you think?
People are starting to seek alternative health a little bit more.
Okay.
They're getting sick of the pill bottle and the injections and the surgeries. There's always a time and a place for all of those things, obviously, right? But too many people are kind of starting there.
Okay.
And they're not getting to see the other side, the chiropractic, the physical therapy, the exercise, the rehab. And people are starting to wake up a little bit and say, there's benefits here. There's clinical benefits, there's research benefits, and chiropractic's been around since 1895.
Okay.
There's a reason for that.
Yeah,
right?
yeah.
It works.
So basically, people are saying, okay, I can eat healthier, I can diet a little bit, but you're saying they need to take it further, right?
Sure. I mean, at a first attempt to reduce your pain, chiropractic, PT, change in nutrition, those things are very, very effective if they're done appropriately. If that doesn't work, then take it up the scale, medical evaluations, etc. A lot of patients that come into our office, we see a lot of serious conditions, and there's a lot of times I go, I can't help you until you go see your medical doctor.
Yeah.
Make sure that stuff's cleared so it's safe for us to treat you, and if it's something that's very serious, we caught it early. So I think that's definitely important.
Yeah, very important. You mentioned off the air to me, and I would like you to explore a little bit more into that.
Yeah.
Is the MLS laser, right?
Yeah.
What
MLS.
is that?
It's a multi-locked system.
Okay.
Laser, so it's a class 4 laser. So I don't know if you know much about lasers. So lasers are used for surgery. They're used for animal application and human application. They're used to cut metal. It just depends on how the light is funneled, right? So this particular laser is the most potent laser in the United States for human application. So it's typically used by orthopedic specialists, orthopedic clinics, things like that. Luckily, it is extremely effective, and we're able to bring that to the small town. So its success ratio is 90% on reducing pain and inflammation. So it kind of acts like a steroid injection, but without having the needle, and you have to do it a few more times to get a similar like effect. So
do you mind going me one step further and give us a scenario? How would you use that application then?
Sure. Let's just go with the knee. So let's say someone comes in, they have a meniscus irritation or sports injury, it's all swollen. Bingo. We put them underneath the laser. As long as we go through all of the precautions, there's zero side effects. The laser goes in, helps to break up that tissue, bring blood to the area, flushes the inflammation out, reduces the pain receptors.
How immediate? Like
within 1 to 3 visits.
Wow.
Typically, people feel better. It does take longer with more chronic conditions. So up to 12, 16 visits, sometimes with very chronic, like disc issues or neuropathy-like things.
Why did you want to go this direction with having something like that?
Research. So research is very big with this particular laser. And with it being the most effective, we decided we're just going to get the best one that we can get because there's no sense upgrading later.
Yeah, absolutely.
So,
very impressive.
Yeah.
Is that the only service that, additional service that, or non-traditional, I don't even know if non-traditional is the right word.
We have chiropractic. We have our MLS laser.
Okay.
We have other rehab services. So we have intersegmental traction. We've got cervical traction. We have muscle stimulation and ultrasound therapy. So we're trying to create a clinic. If people come in pain, we have a lot of options to exhaust before I have to send them to medical, etc. Yeah.
And people come through your door. I know this might sound like a weird question, but people come through at the extreme point. They walk through the door, and you have to react because, I mean, at that, most people only go in when, hey, I'm really hurting. And you have to be ready for that from a physician standpoint, right?
Yeah, we have people come in, canes and walkers because they're in so much pain. Some people that are younger with canes coming in, or just in general, hey, I slipped off the hay trailer or whatever. We're in a rural area, so we see a lot of that kind of stuff.
Yeah.
But yeah, we're ready to rock and roll if you're hurting. So
there you go.
Yeah.
Well, I appreciate you coming in.
Yeah.
If people want to get a hold of you, take us through how they can walk through the door, obviously, but from an appointment standpoint, we want them to give you a call prior to, right?
Absolutely.
All right. I know this is going to sound weird. Do you know the phone number? Your phone number off the top of your head?
It's 231-757-3356, or you can look at us on Google, Squires Chiropractic. You'll see plenty of reviews and information, and website links, etc.
All right, sounds good. Some people don't know their own phone number, so I wanted to make sure that you're okay. Well, we appreciate you coming in, and for the listening audience out there, if you missed any of the segment, it'll be archived right there on our Facebook pages, Mom FM and Hot Country Hits, our YouTube channel as well. But Best Business in Scottville, Best Chiropractor, Reader's Choice Award from the Ludington Daily News. So congratulations on those achievements.
Thank you.
And we appreciate you coming in. Now you get to go to work right now, right?
Yeah.
Okay.
I'm headed straight from here to go treat patients.
There you go. Way to do it. All right. We appreciate you coming in. 8:01 now here on 102.7 WMOM and Hot Country Hits 99.9. News, weather coming to